Hello everyone, I'm Himanshu. I'm a gynecologist in Hertfordshire and welcome to our channel. I hope you are enjoying the informative lectures. The sole purpose of these videos is to spread awareness of various women's health issues, and if you need any specialist advice, please get in touch with a specialist and take their guidance. Lots of people asked me to talk about PCOS. It is polycystic ovarian syndrome. In olden days, it was called PCOD, polycystic ovarian disease, and eventually they realized that it is not actually a disease but a collection of various symptoms, and that's why now it is changed to polycystic ovarian syndrome. We used three criteria to diagnose PCOS. One of them is no periods or irregular periods, and second is either clinical or biochemical evidence of hyperandrogenism, that is excess testosterone, and third, excess number of follicles in the ovary on ultrasound scan. 2 out of 3 symptoms can diagnose PCOS. Now, the rule of thumb is if you ovulate regularly, you have regular ovulation. If you ovulate irregularly, you have irregular ovulation. And if you don't ovulate at all, you don't have ovulation. And that's why it is very important to keep a track of your periods with any app you like. And if for 6 months or more, if your cycles have been irregular, it's a reasonable thing to get a specialist's opinion. Now, having polycystic ovaries is one thing, which means too many follicles on ultrasound scan. And almost 20% women on scan are found to have polycystic ovaries. However, having polycystic ovarian syndrome is an entirely different thing. Only 6 to 7% of these patients will actually have the syndrome. And it can lead to menstrual irregularities, reduction in fertility, meaning difficulties in getting pregnant, hormonal imbalance, and changes in external appearances. The common symptoms of PCOS are irregular periods or no periods at all, difficulty in getting pregnant, having more facial or body hair than it is usual for you. It's also called as hirsutism, loss of hair on your head, being overweight, rapid increase in weight, and difficulty in losing weight, oily skin, acne, depression, and mood swings. Although every patient will have a different cohort of these symptoms in different severities. Unfortunately, there is no cure for PCOS. It is to do with the genetic makeup and sometimes family history. And that's why the management mainly depends on the symptoms, how they are affecting you, your lifestyle, and if you're wanting to get pregnant or not. If you're not wanting to get pregnant and just wanting to sort your periods, then all the hormonal treatments which are available are mainly contraceptives, and that's why they won't help you, especially if you're trying to get pregnant. And these will involve oral contraceptive pills, progesterone only pills, implant, depot injection, Mirena coil, depending on your preferences and your needs at that time. If you're suffering from hirsutism, acne, then we have to rule out other causes of hyperandrogenism, and if PCOS is diagnosed, then we will be helping you with different types of medication which help to control the symptoms. Myoinositol is one molecule which helps to improve insulin resistance in these patients, which is the basic pathology leading to all other symptoms in this syndrome. And that's why we do recommend myoinositol supplements, and sometimes, depending on patient's group, metformin can be given as well. However, before starting any medication, please do consult your gynecologist and or a fertility specialist and take their advice. As I mentioned earlier, the main problem here is the insulin resistance, and because of that, there are lots of symptoms arising in this condition. One of the other issues these patients suffer is from weight gain, and the symptoms get worse as the weight gain increases, and that's why losing weight and achieving normal BMI would definitely be helpful, for which you need to maintain a healthy lifestyle, have a diet which is high in proteins and low in carbohydrates, whole grains, whole foods, fruits and vegetables will definitely help. Due to oily skin and acne and hirsutism, sometimes it can affect your external appearance, which can have a direct impact on your self-esteem, leading to depression and mood swings. So if you are suffering from these symptoms, please consult a specialist and take their advice for managing these symptoms. PCOS is a syndrome, and that's why it has got long-term implications as well. And one of them is developing type 2 diabetes later in life. The risk is more if you're over the age of 40, if you have a strong family history of type 2 diabetes, if your BMI is over 30, and if you ever had developed gestational diabetes, that is diabetes in pregnancy, then your risk of developing type 2 diabetes in future is higher. PCOS patients are also known to develop high blood pressure, and because of that, some cardiac issues may arise in future. These patients have hyperestrogenic state, meaning their estrogen levels are higher than usual, and the endogenous progesterone is very small in amount or almost negligible, and that puts the endometrium, which is lining of the uterus, to the unopposed estrogen all the time, and that's why if not treated or managed earlier, it can lead to certain abnormalities like complex atypical hyperplasia or increase the risk of endometrial cancers in future. If you're trying to get pregnant, then obviously you will need to see a fertility specialist, and there are various treatments available. And because the irregular or no ovulation is the main cause of fertility or infertility, and if the male partner is absolutely fine, with various treatments the pregnancy rates can be as normal as the woman of your age group with no PCOS. So if you're suffering from these symptoms, it is worth seeking a specialist advice. Thank you.